Om Gan Ganapate Namaha. Good morning to everybody who has joined our session today. I am Raksha and you're watching Vydehi Hospital, sir. Good morning, sir. Welcome to the show.
Thank you. Thank you.
Talking about sir's experience, 28 years of experience plus 15,000 plus cardiac surgeries, and sir is one of the India's leading cardiac surgeons, having his expertise in minimal invasive cardiac surgeons, heart transplants, valve replacement, pediatric heart. One among these surgeries, treating 1.8 kg of newborn baby, which is suffering from congenital heart disease, and standing out having complex heart surgeries and handling a lot of heart cases. So, we are very honored to have you today, and thank you for taking some time and sharing your valuable insights with us. So, talking about your journey, we have 28 years of experience and 15,000 plus surgeries in this. You must have met a lot of patients, irrespective of their ages, different cases. Can you just share in simple words how was your journey with this institute?
We have been indicated for doing surgeries on the heart. So what we do at Vydehi is not only adult. We do congenitals, adults, transplants, vascular. The whole spectrum is done at one unit. This is what Vydehi's specialty in cardiac surgery. So we do everything, whatever comes our way. We don't say we are adult surgeons, we are pediatric surgeons. So whatever comes our way, we do. And I always believe in patients are God. So there's a big saying, no point opening a shop without a customer. So you can have multiple degrees, you can have multiple expertise. But imagine you don't have patients. So Vydehi has made me to become a surgeon, to be frank, because the patients are our Lord and patients are God. And so patients are plenty here. Yes. And that made us a complete team, which has been very successful. And we've been doing good run for almost 22 years at Vydehi. So we've done multiple surgeries. You name the surgeries we must have done, not in single numbers, in multiple numbers.
So before we get into heart disease and explain, can you say in simple words what is the function of the heart and why keeping our heart is very healthy?
Yeah. See, heart is just a muscular pump. Suppose imagine you have a motor at home, motor is not working, you want to get water to your tap. Similar. Heart also does the same thing. See, heart pumps the blood. Oxygen-rich blood is required for complete function of the body. Anywhere, any part, it requires oxygen-rich blood. So heart does that. Suppose you see, heart actually beats 1,000 in a day. 1,000 beats are happening in the heart. So what happens is when the heart is pumping oxygen-rich blood, it supplies completely oxygen-rich blood to lungs, liver, brain, including your air, skin, everything requires oxygen-rich blood. So it is very mandatory, I have to say, you have to keep your heart healthy. Suppose you're not going to keep your heart healthy, then this perfusion is not going to happen. You're not going to get oxygen-rich supply to your body parts. So keeping your heart is very important. This is for the viewers also. Because once you keep your heart healthy, you live longer. And also you have a very luxurious, what do you say, very luxurious life in terms of health. That is important. Health is wealth actually nowadays. Nowadays, keep your health well. Heart is very important because you have to perfuse your body organs in a very good oxygen-rich blood. It's very important.
Yes, sir. So as you said, heart like keeping our heart healthy and health well. And now everybody are also technology is increasing and people are aware of few terms and they say there are two terms: cardiac transplant and heart transplant. So are they both same? And when do a patient require a heart transplant?
So cardiac and heart transplant both the same terminology. Common people say it as transplant. We call it cardiac transplant. Sometimes vice versa. We can say cardiac is nothing but heart. Heart transplant is done when it's an end stage disease. When nothing can be done. The heart is failed completely. That means the medical management, the procedures, the surgical management, everything is going to fail. Nothing is going to work for the heart. Then
so I think we're having a caller.
Yeah.
Can we go with the call?
Yeah, please.
Hello.
Good morning, doctor.
Good morning, sir.
Morning.
May I know your name, sir?
My name is Deepak. I'm from Vydehi.
Yes, sir. Where are you from?
I'm from Vydehi.
Yeah, please go ahead, sir. I'm ready to answer your question.
Yes, I'm 35 years old.
Yeah.
Should I get my heart checked even if I don't have any symptoms?
Symptoms is not matter. Do you have any risk factors like diabetes, hypertension? Are you a smoker?
Hello, sir.
Yes.
Yeah.
Can you hear me, sir?
Yeah, I'm audible.
If you have any risk factor, I think after 30 years you need to get your heart checked every year.
Yeah, I think there's some technical trouble. Get back to so. At 35, here we mentioned, we are also seeing a lot of young people are facing the heart diseases, heart transplants, and a lot of people die due to heart attack. And now it is not respective of age. Can you share like
Yeah,
why
see,
lot of young people
age is, those days when you talk about 20, 25 years of cardiac surgery, it's always above 60 years who gets a heart attack. And that is what it has been. Now, the current situation, the work pressure and other thing, the stress involved, the habits involved for people is completely different. So what I say is people who are having risk factors like diabetes, hypertension, who've been smoking cigarettes, yeah, 3 cigarettes a day is enough. Nicotine stays for 8 hours a day. So 3 cigarettes is enough to kill a person, technically speaking. Alcohol, people say taking small amount of alcohol is good for her. It's not correct because alcohol will dilate the arteries. Well, the more the arteries are dilated, more slow flow to the coronary system, and the heart doesn't get much of a blood supply. I think youngsters nowadays we find so many
Thank God, sir. We are
things.
getting another call. Hello.
Good morning.
Good morning, ma'am.
Hello.
Your name?
Morning, ma'am.
Sir, good morning, sir.
Morning.
Where are you from, ma'am?
I'm audible, sir?
Yes, yes, you're audible. You can talk.
Yeah, you are.
You ask your
Yeah,
question.
yes, sir. This is Monica
Yeah,
from
please.
Yes.
Panchanti side.
Yes, ma'am. You can go. You can start.
Hello.
Yes, ma'am.
Yeah,
You're
please start,
audible.
ma'am. I'm listening to you. I'll answer your question.
So the thing is, previously, like my father had a heart attack.
Okay.
Is there any higher risk to? Does that mean anything?
Yeah, you have heart attack. You need to get an angiogram done. Have you done your angiograms for your father?
No, sir. I think no.
No, you should do your angiogram. Otherwise, it's not complete. The treatment is not complete. You need to see your angiogram, see whether what is the cause for the heart attack, which vessel is blocked. Then we need to plan for medical management. Either any angioplasty has to be done, like what do you call it, a stenting, or a bypass surgery. There are options. But before getting into the option, we need to see what is required for this patient. Angiogram is the gold standard.
Okay, okay. Like it's normally just a mild heart attack they have.
No,
So
it can
for
be
that
mild,
purpose,
moderate, severe, but angiogram is a must. When you say there is a heart attack, you need to get your angiogram. The gold standard is to do an angiogram to sort it out what it is.
okay. So
Okay.
we need to check once.
Yes, yes. Angiogram is a mandatory, ma'am. Don't take it lightly. You have to get it done.
Okay, sure, sir. Once we check with that.
Yes, ma'am. Thank you.
Thank you, ma'am.
Yeah, thank you so much for the information.
Yes, sir. So we were talking about young people getting heart
So this is
attack.
what see what happens. Young people, they work pressure is too much. They get into stress. The moment there is stress, what happens? There will be a lot of catecholamines released. That will
Sorry,
block
sir.
the.
We're getting another call. Hello. Hello.
Hello.
Yes, sir.
Yes, sir. We are listening to you, sir.
Hello.
Hello, sir. Yes, sir. You're audible.
Yeah, there's a nice session going on now. So we
Yes.
connect with the
Yeah,
Talk
please.
to the
I'm
doctor.
here, sir. I'm listening to you. You can go ahead with your question.
Hello.
Yes, sir.
Sir, I'm listening to you. You can go ahead with your question.
Sir, we are at 35, but cholesterol is somewhere around 360.
Okay.
So, we need to go ahead with the tablet or we need to go with the diet.
So Sir, I think you need to consult the cardiologist. Yes, you need to be on diet. You need to lose weight if you're obese. You need to control your diabetes. Hypertension is there. You need to control. You need to get the cholesterol levels down because that will produce a plaque. That will combine with other systems and produce a plaque in the coronary artery. So you need to reduce your cholesterol. So that is too high. So you need to control the cholesterol levels. You need to consult a cardiologist, sir, straight away, or you can come to us. We can evaluate you for further and we'll see what best we can do for you.
Okay, because one of the doctor have suggested for Lipika
Mm-hmm.
safe to take it or like
Yeah, you can take, sir. It is safe only, but you need to also see, because abruptly taking medication also is not okay. There's a lot of advanced medications have come which doesn't produce effect on the liver, doesn't produce myalgia. So I think you need to consult us at Vydehi to give you appropriate things what you have to do.
okay, fine, doctor.
Thank you, sir.
Thank you.
Yes, sir, we were talking and consulting, and in our institute, how is the manufacturers and equipments for cardiac surgeries in
I
Vydehi?
think we are well equipped. We are geared to do any kind of surgery. The equipment, suppose ECMO, IBPs, ventilators, we all advanced technology what we have at Vydehi.
Yes,
So
sir.
it's all world standard. That's what I put it. What we have at Vydehi is just there's nothing difference. What others have in the world and what we have.
Yes, sir. So moving on, like there's a person who just develops a chest pain, and at the home in his family, what are the measures that his family should take care before coming to the hospital, and what are the things they shouldn't do? Like people just see in random things and just start performing, and they don't know what the right things to do. So can you
Suppose
just
someone
guide them?
is alone at home is getting a chest pain.
Yeah.
Most important thing is they should not panic. And if he's okay, give a call for help. First and foremost thing is open the door. Don't go and lock the doors. Open the door. If the door is locked, keep the door open. Call for help. Okay. And be calm. Don't do any excitement work. Like don't do any activities. Just sit down or lie down and wait for the help to come. And most important is if anyone is above 40 years and there are risk factors like diabetes, hypertension, and they've been smoking, not able to, that's a different topic itself.
Yes.
What I suggest is you need to have aspirin at home. 325 milligram of aspirin is always better to keep at home because what happens, it will prevent 30% of myocardial infarction. That means the heart doesn't fail when you have a heart attack. At least you'll go to the hospital safely and the doctors can perform your angiography, surgeries, whatever it is. So I feel there's other school of thought where they say always better to keep aspirin 325 milligram, clopidogrel, what do we call sorbitrate, put your 5 milligram sorbitrate sublingual. But most important is you should always, anyone who is above 35, 40 years should check their numbers, their heart rates, their BP. They should know their numbers. Any variation in those numbers, immediately go to the hospital, get it checked thoroughly. This is what I suggest. So always check your BP if you have a BP apparatus at home. It's all self apparatus are available now. It's available in watches. So they need to check, be calm, don't get panic, call for help, immediately rush to hospital and that will be taken care.
So how often we should get our heart checked, sir?
Risk factors, I think every 6 months to 1 year. No risk factors, at least once in a year, you need to get your heart checked.
Yes, sir. So family members around, what are the things they can do to just before bringing to the hospital? What are things they have to do?
See, they'll have to keep the patient calm and they'll have to rush him to the nearby hospital where there's a cath lab center. The hospital, they cannot go to a normal hospital and say that we've got a heart attack and thanks, our chest is paining. What I feel is always, there are multiple hospitals available now. So most of the hospitals have a cath lab. Cath lab is where they perform angiograms. And so I think someone is having a heart attack or a chest pain, which is supposed to be a heart attack, they need to move to a hospital where there's a cath lab. The golden hour is very important because the heart shouldn't infarct, it should not fail. That muscle should not be dead at that moment. So before that, we need to catch him. So this is very important. I think everyone should rush to the hospital. They should not take it lightly. I've seen a lot of people, when they have chest pain, they take antacids, they'll push it. They'll push it to next day morning, afternoon, until they become serious, they don't rush to the hospital. That's not correct. When you have a chest pain, when you know that the chest pain is not reducing with the proton pump inhibitors like PAN-D or Gelisul MPS, you take it's not coming down, I think you need to go to the hospital immediately and get your ECGs, troponin. There's a blood test to be done where some enzymes are released into the blood. So all these things has to be checked. When something is really positive, you need to go ahead with angiogram.
Yeah.
So angiogram will give you the correct picture where the arteries are blocked, not blocked, whether recanalized, what should be done. Okay.
Yes, sir. So a lot of people think that I've just developed a pain in my left arm. It could be a heart attack. They simply suspect and they're very scared about it. So what would you do?
That's what I'm saying again. If they suspect it's going to be a heart attack, better go to the hospital and get it checked with a specialist. They'll be exactly
So we
doing
have a
what
caller.
it is.
Hello?
Hello.
Yes, ma'am.
Morning, ma'am. Morning, ma'am. We are listening to you.
Yes, sir. Good morning. Sir, I have a doubt.
Yeah.
Yeah.
I am turning now 35 years, sir.
Sure.
So I wanted to know what my test I should go, sir, because I am facing leg pain, back pain, this not I have.
Okay. So what is your risk factor, ma'am? Are you diabetic?
Nothing, sir, such.
Ma'am, I feel if you feel there is a chest pain, your fatigue, your
I am facing the back pain.
back pain
and
is there.
leg pain, sir.
Okay. Ma'am, back pain alone is not. Any other symptoms you're having, like chest discomfort, fatigability, you're tired, something like that?
I feel tired.
Okay. So, ma'am, I think you can get your checks done, like your lipid profile, your treadmill test.
Suggest me some tests, I go under to that, sir. I can.
Ma'am, you should consult a doctor, ma'am, in person.
I should consult.
Yes, yes, ma'am. Because what happens is,
Yes, ma'am, you can consult Vydehi.
ma'am.
Sir, if you suggest me some tests with the reports, I can come and meet you, no, sir.
No, that is not appropriate, ma'am. You come to us because sometimes may not require anything.
Sometimes it's not
Not required. Yeah, we need to see you in person. Then we'll suggest you the best thing. In case you have something, we find something, then we'll definitely. If you're really not able to take it, then I think you should come to an hospital and consult a cardiologist, ma'am.
Okay, sir.
We'll be waiting, ma'am. 24 hours into 7 we are available. I think you can walk in any time.
Yes, sir. Yes.
Yes, ma'am.
Yes, ma'am.
Thank
You
you.
can consult our doctors at Vydehi at any time. Thank you.
Oh, okay, ma'am.
Yes, sir. So they were discussing and consulting a doctor, and you also mentioned like people should rush to any hospital about like, having cath labs and everything. Yeah. In our hospital, like how many cath labs are there? How
We
are
have two cath labs.
Okay, sir.
So we have two cath labs and two exclusive operating theaters for cardiac surgery. And we have a 14-bedded cardiac surgical ICU and a 12-bedded angiogram procedure ICU, CCU, what we call coronary care unit.
Yes, sir. So in earlier time, for a heart surgery, it just takes 2 hours, 3 hours. Now, technology has developed. We have a lot of equipment. Now we are performing in a very shorter period of time comparatively. How do you talk about?
It's not like shorter period or longer period. Whether technology, the more technology is improved, the time has become longer actually. Actually, if you take minimal invasive or robotic cardiac surgery, the time taken is more actually. Because the open standard techniques have, because they've expertised in that field and their approach is much faster because they've been doing this for ages. And certain thing is what all this technology is what has come in, not it's all the appearance which is giving us. The minimal invasive, robotic, all the scars are small, the recovery is much faster. But ultimately in cardiac surgery alone, what we do inside the heart is very important. The technique what we follow to anastomose or attach things or put a patch closure for holes in the heart, that technique is very important. Whichever method you take, whether it's minimal invasive, robotic or open, you need to do a perfect job when it comes to the repairing the heart.
Yes, sir. So, for an example, a patient has just got his heart transplant. What is the recovery time, and what factors depends on it so that he can recover fully?
See, heart transplant is also like another surgery. The recovery time is going to be the same. The recovery time of any cardiac surgery is going to depend on the patient itself. Whether if he's a diabetic, he's old, his immune system is a little less, his healing capacity is not like youngsters. So all these things, there are a lot of factors which is. He's been smoking the day before surgery also. Then the recovery time is going to take longer. If he's non-smoker, he's no risk factors, then the recovery time is going to be much easier.
So age factors, sir. So now youngsters, lot of people, we are nowadays IT, we sit for long hours and we think we are slim, we are fit, our heart will be healthy, we'll not need to check our heart, and if we do workout or gym, it will be fine with us, but still people
See, I've seen people working out for 1 or 2 hours, then again coming and sitting in office for so many hours. It's not good again. Because inactivity, what happens, it will clog your bloods. Blood will become stasis. So that will produce blocks in your small vessels. Small vessels, coronary artery is a small vessel, so you can get blocks. So I always feel it's not slim or obese. Most of the surgeries what I have done, the people for bypass surgery, they are almost slim only. They are all very thin. So those factors are not involved here. You need to be healthy. That means you need to be active. You need to take a good healthy diet. Moderation of healthy diet is important. Moderation of high fried foods is not good again. Moderation of a healthy diet is very, very important. And control your diabetes. Hypertension has to be below, I always feel 130/90, should be the benchmark for anyone above 40 years, not more than that. And other risk factors like stress should not be, because stress is also becoming, in India, if you see, the working member of the family gets a hit because they take a lot of stress. Once you are stressed out, what happens, you'll become inactive. You will start eating junk foods. You will not do any exercise. What happens is the stress will add on to the risk factors, and the vessels can become sticky. The vessel can go in for spasm, and the blood can become stasis and clot and block your coronaries and produce heart attacks. We have seen that happening. So stress plays a very major role. Being stress-free, meditate, you should not take too many things into your heart. And so move on and be active. That is important.
So being stress-free and free. So can you share some 5 easy tips for the people who are watching, to our viewers, so that they can maintain a healthy heart?
Healthy heart is strictly no smoking, no alcohol, no...
We'll take a short break before we can.
Sure.
We'll come back to you.
ಹೃದಯಗಳಿಗೆ ಹೊಸ ಜೀವ ತುಂಬುತ್ತಾ ಅನೇಕ ಜೀವಗಳನ್ನು ಉಳಿಸುತ್ತಾ ಸಮುದಾಯದ ನಿರಂತರ ಸೇವೆಯಲ್ಲಿ 25 ವರ್ಷಗಳ ಪಯಣ. ಈ ಮಹತ್ವದ ಮೈಲಿಗಲ್ಲನ್ನು ಆಚರಿಸುತ್ತಿರುವ ಸಂದರ್ಭದಲ್ಲಿ ಬೆಂಗಳೂರಿನ ವೆದೇಹಿ ಆಸ್ಪತ್ರೆ ವೈಟ್ ಫೀಲ್ಡ್ ನಿಮಗಾಗಿ ವಿಶೇಷ ಯೋಜನೆಯನ್ನು ಪರಿಚಯಿಸುತ್ತಿದೆ. ಗುಣಮಟ್ಟದ ಆರೋಗ್ಯ ಸೇವೆ ಕೆಲವರಿಗೆ ಮಾತ್ರವಲ್ಲ, ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಸಿಗಬೇಕು ಎಂಬ ನಮ್ಮ ಪ್ರಯತ್ನ. ಅತ್ಯುತ್ತಮ ಗುಣಮಟ್ಟದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳನ್ನು ಈಗ ಅತ್ಯಂತ ಕೈಗೆಟುಕುವ ವೆಚ್ಚದಲ್ಲಿ ಪಡೆಯಿರಿ. ಸರ್ಕಾರಿ ಆರೋಗ್ಯ ಯೋಜನೆಗಳ ದರಗಳಿಗೆ ಅನುಗುಣವಾದ ವೆಚ್ಚದಲ್ಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳು ಮತ್ತು ಈ ಸೌಲಭ್ಯಗಳು ಎಲ್ಲ ರೋಗಿಗಳಿಗೆ ಲಭ್ಯ. ಜನರಲ್ ಸರ್ಜರಿ, ಆರ್ಥೋಪೆಡಿಕ್ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ, ಕಿವಿ, ಮೂಗು, ಗಂಟಲು ವಿಭಾಗ, ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆ, ನರಶಸ್ತ್ರ ಚಿಕಿತ್ಸೆ, ಮೂತ್ರರೋಗ ವಿಭಾಗ ಸೇರಿದಂತೆ ಹಲವು ವಿಶೇಷ ಚಿಕಿತ್ಸೆಗಳು ಒಂದೇ ಸ್ಥಳದಲ್ಲಿ. ಅನುಭವಿ ತಜ್ಞರು, ಆಧುನಿಕ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ಕೊಠಡಿಗಳು, ವೇಗವಾದ ಚೇತರಿಕೆ ಹಾಗೂ ಸಂಪೂರ್ಣ ಆರೈಕೆ. ವಿಶ್ವಾಸಾರ್ಹ, ನಂಬಿಕೆಗೆ ಪಾತ್ರ, ಕೈಗೆಟುಕುವ ದರ, ಪ್ರತಿಯೊಬ್ಬ ರೋಗಿಗೂ ಶ್ರೇಷ್ಠ ಸೇವೆ ನೀಡುವ ಬದ್ಧತೆ. ವೆದೇಹಿಯಲ್ಲಿ ಆರೈಕೆ ಎಂಬುದು ವಿಶೇಷ ಹಕ್ಕಲ್ಲ, ಅದು ಪ್ರತಿಯೊಬ್ಬರ ಹಕ್ಕು. ವೆದೇಹಿ ಆಸ್ಪತ್ರೆ 25 ವರ್ಷಗಳ ಶ್ರೇಷ್ಠ ಸೇವೆಯ ಸಂಭ್ರಮ. years of healing hearts, saving lives, and serving communities. And now, as we celebrate this milestone, Vydehi Hospital, Whitefield, Bengaluru brings you something truly special. Because quality healthcare should be accessible to everyone, not just a few. Introducing high-quality surgical care at remarkably affordable costs. Surgeries priced to match government scheme tariffs with eligibility extended to all patients. From general surgery and orthopedics to ENT, oncology, neurosurgery, urology, and more, all under one roof. Supported by experienced surgeons, modern operation theaters, faster recovery, and complete post-operative care. Trusted, reliable, affordable, delivering excellence with every patient we serve. At Vydehi, care is not a privilege, it's for everyone. Vydehi Hospital, celebrating 25 years of excellence and a lifetime of care.
Vydehi Hospital Live Ask the Expert. We are continuing our discussion with Dr. Durgaprasad Reddy sir. Sir, to continue, we were just talking about healthy tips to maintain a healthy heart.
To maintain a healthy heart, everyone should exercise. At least 1 hour of brisk walking is mandatory cardiovascular exercise. I've seen people doing exercise for 2 hours, 3 hours. You know what happens when you do for such a long time exercise? You're sustaining the heart rate, higher heart rate for a long time, which is not good because your coronary blood supply is always in diastole. That means your heart rate should be low to supply the coronary. If you keep your only systolic heart rate is high, it's only so that means it's contracting too much and the blood supply to the coronary is not happening. So you can develop. We have seen youngsters in the gym having heart attacks. You know, after the gym, coming and resting at home, they're having heart attack because they're sustaining the heart rate for a very long time, which is not good. And second thing is eating habits, healthy diet, moderation of everything is good. Don't eat fried chicken. I think fried chicken and sugars have to be stopped for children from the age of 5 itself. They should not be given any sugars or fried chicken because fried chicken is very dangerous. And of course, smoking. Smoking, 3 cigarettes, as I said before, 3 cigarettes is enough to kill you. Nicotine stays for 8 hours. What does this nicotine do is it clogs your artery. It makes the blood like a tar. Then there will be clot formation. That clot can become calcific and block your arteries. So smoking is not good, not only for coronary. Smoking will universal, complete body, wherever the small artery is there, it will go and block. Because smoking is strictly no to smoking. You've seen a lot of women smoking nowadays. I think they say, you know, to release stress they smoke, you know, but they're going to have more stress if they're going to smoke like that. So, because see, usually in older school of thought, women's are protected because of the estrogen levels. After menopause only they get heart attacks. My least lady was 22 years old who's been smoking for so many years. I've done a bypass surgery for her. So I think smoking is very, very dangerous. And same way alcohol. It's a myth that alcohol, you know, will 2 pegs every day is good for the heart. It's a myth because alcohol is going to dilute your arteries, and that dilated artery, there's going to be a slow flow to the muscle which is going to supply. So then risk factors like diabetes, hypertension should be controlled, and be active, be healthy, be stress-free. That means you have to be, what makes you happy, you do that. That is what is important.
Yes, sir. So you mentioned like smoking, fried food, and other things, alcohol and all. Like, what are the lifestyle mistakes people are making nowadays?
These are the mistakes. These are the mistakes they do. Because I've seen, you know, the moment they finish, they get out of the chair in the IT or anything, they come outside and the first thing they pick up is smoke.
Yes.
You know, I've seen plenty. You know, our Whitefield is completely surrounded with IT hub. I've seen a lot of people smoking, being stressful, taking their job is very stressful. You should enjoy your job. Job can be tough, easy, anything. But if you enjoy your job, then that won't be stressful to you. That's what we put it.
Yes, sir. We have heard a lot of cases like people are sleeping to the left side or and they're sleeping above their stomach, and it is good or bad. And if sleeping left side cannot cause heart attacks or all these. Is it a myth or?
It's a myth only, because you can sleep whichever way you want. But what they say is sleeping on the left side, you won't get acid reflux because the stomach is falling away from your esophageal stomach junction. It falls away, so you won't get that acid reflux, and suddenly you will not aspirate in the night. It's a myth. For heart disease, it doesn't matter. An advanced heart disease failure, you can't sleep flat, because the complete heart is failed. It won't pump much of blood into your body, so it can pump blood into the lungs and produce breathless. So people always sleep for sleep in an inclined position. They keep 2-3 pillows and then they try to sleep. This is what they do.
Yes, sir. Now we were talking about young people, and we also we'll talk about the children. Like as your new case of treating a 1.8 kg baby. Now children are also getting. How parents should be careful about it, sir?
See, that's what children get heart disease is all congenital heart disease. Right from birth, they have some defects in their heart. So this is what children. So this has to be done right from antenatal. When the mother is pregnant, strictly they'll have to be very careful. 5th month anomaly scan is done for a mother to see whether there is any defect in the heart, so that you can plan whether the child can be managed after birth, whether it's operable, inoperable, all can be planned at the 5th month anomaly scan. And most important is they'll have to be very careful during pregnancy. Antenatal checkups are very important. They have to, all this infection like maternal rubella, all these things can be avoided. No alcohol. Lot of women in previous days, when they have cough, cold, they take a little bit of brandy thinking that the cold will go away. But that is going to affect on the child. Smoking is going to affect on smoking will produce intrauterine growth retardation. The child is born very small, that can produce heart defects. You take alcohol, that is going to be more dangerous. There's something called as fetal alcohol syndrome. That means there will be a lot of defects like tetralogy, ASDs, VSDs, that is atrial septal defect, ventricular septal defects, all can be produced. So alcohol is not good. Then some people, when they have pain, they take aspirin during pregnancy. Aspirin will produce primary pulmonary hypertension at birth, because it will close off the PDA. During fetus, that is when the child is in the womb, the circulation is different, not like adults. So the circulation is completely through something called as patent ductus arteriosus. Through that, the blood is circulated for the child. Suppose you take aspirin, what happens? The child is born, it closes off, and then the lung pressures are very high, when it's birth. So all these things, antenatal checkups, consulting cardiologists. Any child is born, technically speaking, you need to get an echo done, because to see there is no defect. Because what happens in India, still we are finding they are not coming at a very early stage. They come at a very late stage for their checks.
Yes, sir. We'll go with the call.
Please. Morning, sir.
Morning, sir.
Yeah.
Sir, ಹೆಸರು ಅರುಣ್ ಅಂತ, ನಾನು ಕೆಳಪುರಮಿಂದ ಕಾಲ್ ಮಾಡ್ತಿರೋದು.
Okay, sir. ಹೇಳಿ ಸರ್.
ಸರ್ ಆ್ಯಕ್ಚುಲಿ ಏನಂದರೆ, ಈಗ ಸ್ಟೆಪ್ಸ್ ಹತ್ತುವಾಗ ನನಗೆ ಚೆಸ್ಟ್ ಪೇನ್ ಬರುತ್ತೆ ಸರ್.
ಎಷ್ಟು ಸ್ಟೆಪ್ಸ್ ಚೆಸ್ಟ್ ಪೇನ್ ಬರ್ತದೆ ಸರ್?
ಹೌದು ಸರ್.
How many steps you are getting chest pain?
Sir, actually like 20 to 25.
The moment you sit down, it is becoming all right, sir?
It's for sometimes, sir. After sometimes.
See, usually whenever someone is climbing 20 steps, you will get slight breathless, sir. But chest pain is unusual. If you get chest pain during climbing stairs, I think you need to have a check, sir. You should come to hospital, get your checkup done.
Okay, sir.
You have to get your ECG, troponin I, and then we'll see, sir, what it is. Whether it's really cardiac pain or it's something else.
Just.
Yes, sir.
Sure, sir.
So please visit hospital, sir. If you are very careful, Vydehi is very close to you. You can walk in any time. You can walk into our EMD or you can walk to the cardiology department. We'll take care of you.
Sure, sir. Thank you, sir.
Thank you, sir.
Thank you. So, yes, sir, we were talking about children's heart conditions, and
This is what. So all children should be screened echo at birth itself. Because why to mess? Suppose there is a ASD for a child. It will not be symptomatic up to 30 years. There are certain conditions only symptomatic at birth, or very few conditions are symptomatic at birth. So why to take a chance? That's why I conduct camps as India. The reason for conducting camps is to screen these people, to find out any disease they have, and then treat them appropriately, because you're catching them at the early stage. Early stage, good results. That's all it is. You come at a later stage, your results are not going to be good. This is what it is.
Yes, sir. So in children's, we hear a term called as a blue baby.
Yeah.
So what is a blue baby, sir?
Blue is nothing but child appears blue. That means there is not much of oxygenation happening. The artery which takes the blood to the lungs to get oxygenated, some defect is there. Whether it is tight, it is not there, or it is completely blocked. The most common blue babies in India is tetralogy of Fallot, which is mixed with four conditions. Four components are there. So tetralogies are one of the most common congenital heart disease who are blue. Catching them appropriately, treating them through surgical will have a very good results. I think we have done more than 1,000 intracardiac repairs for tetralogy of Fallot.
So how often would you see such cases with the children, sir, here?
1 in 1,000 live births are having congenital heart disease. I think we see plenty of children who are having congenital heart defects.
Okay, so can children also undergo an heart transplant, and
Yeah.
are their recovery time different from adult?
No, it's not like that. Maintaining a heart transplant child. See, heart transplant means people shouldn't think, like in movies where they transplant the heart and they'll be jumping, dancing. Not like that. You're going from one problem to another problem. So you need to maintain the transplanted heart. Those transplanted hearts can see 70% survival, 70% of them survive for 5 years. This is what a transplant. Child also, when they have a cardiac transplant done, it is a failed heart. Something like cardiomyopathy or complex congenital heart disease where a surgical procedure cannot be performed, then we subject for a heart transplant. And recovery time is going to be same only. But only thing is maintaining a child, teaching the child to keep, what happens, we give a lot of immunosuppressant. That means the heart should not reject, right? Someone's heart we have transplanted. So the heart shouldn't reject. So we keep them on immunosuppressant, making the child understand these things. The mother should be very careful. They should not get into any infection. So many things are there. Child transplant is a challenge. Not in terms of surgery, in terms of maintaining transplant.
Yes, sir. Can you share one of your experience treating any child? How challenging it was? Like how it is different for you to treat a older men comparatively to a child?
Older men understand everything what we say, whether they're listening to us or not. At least they understand what we say, how to maintain their heart, what precautions. But a child doesn't. We have to tell the mother. The mother has to transmit to the child to take care. It's a big challenge. They cannot load the child for some day with more fluids. So many things are there. So we face always challenges. The child goes home very well. They come back after 4 or 5 months for something else because they cannot maintain the child. They think, the child should be fed more.
Yes.
Only then they'll become all right. That will produce more overload to the lungs. And they come back to the hospital with some other problems.
So for the lung, we hear a term called pulmonary hypertension
Yeah.
in the children. So what is it that?
Suppose there is a defect in the heart, like a VSD, that is ventricular septal defect or atrial septal. So naturally, the more blood is going into the lungs. So patient will become pulmonary hypertension. There is something called as primary pulmonary hypertension. At birth itself, there is a lung. Pulmonary hypertension is nothing but the lung pressure is high. So that is, I told you, taking aspirin during pregnancy, the PDA gets blocked. The patent ductus arteriosus, the connecting between the two arteries gets blocked at birth itself. So that will produce hypertension. So that means whenever you see a child with primary pulmonary hypertension, you need to subject for a transplant. Okay.
Yes, so we have a viewer and he's asking a question, and user in the live chat. His name is B Happy Always. So he's saying, "Good morning, doctor. I have painful extra teeth that need to be pulled. Could the bacteria or the infection from his pain impact my heart?"
Suppose your valves are slightly defective. That means a mild leak is there in the valve, or there is a mitral valve prolapse. then you need to take something called as a infective endocarditis prophylaxis has to be taken. That means suppose you're pulling off a bacteria which has infected your tooth, you're pulling it off, or you're extracting your tooth, then you need to be covered under antibiotics. I think once you show your echo report to the dentist or consult a cardiologist, then they'll put them on a infective endocarditis prophylaxis. Like there's some antibiotics will be given before the procedure.
Yes, sir.
So that bacteria, what happens when you're extracting, it will not go on, because all bacteria attracts rough surface. Suppose there is a mitral valve prolapse or a mild leak in the valve, so that bacteria will go and sit on the valve, which is damaged slightly, and produce more problems to the valve. So you always cover under antibiotics and go ahead with the procedures.
Yes, sir. Maintaining the valve, and what do you suggest when do you suggest a patient for a valve replacement, sir?
When the valve is completely diseased, it is not producing enough cardiac output, then you need to replace the valve or repair the valve. Mostly in India, it's because of rheumatic heart disease, infection of the valve. That is because of, suppose we have seen people who are having severe sore throat with joint pains, not appropriately taking antibiotics. That bacteria comes and sits on the heart and it will damage the valve also. Okay, so you need to be very careful when you have a sore throat with joint pain and fever. Okay.
So, yes, sir. On the heart transplants and disease, lot of myths and facts we have, sir. So people think that women can have a different sort of signs for a heart attack. What do you say for that, sir?
Their chest pain is not like men's usually. They have a very vague chest pain, not like a severe throbbing chest pain. Usually they say, but we have seen women's also getting chest pain severely. But in a common basis, when you take, women's are usually fatigability. They're very tired, they're very weak, and they have sweating, and their chest pain is very vague. They're not very vague chest pain they have. They're not having sharp compression chest pains don't develop in women's. This is what we have found.
Yes, sir. So increasing in technology and all the machineries and all. Now we see everything is AI and all the robotics and all they're performing. Now, do you feel like in future we will see a robot or an AI performing a heart transplant?
Possibilities are there, but as a surgeon, I always feel my hand has to touch the heart and do the repair, whether it's through minimal invasive or robotic or open. Your touch is very, because your see all this technology, whatever, you won't get the feel of the tissue. So when you don't get the feel of the tissue, we don't know. It's not time tested still. We don't know the long term results. What is the depth you are going? What is the tissue feel you are taking? We will not know. So we need to wait and watch how it's going to take it up. They've been doing minimal invasive, but still, it's all that sensory perception is not there. So when you don't have a sensory perception, I am little skeptical in commenting on these things. We need to see long-term results, how it's going to be.
Yes, sir. We'll take a short break and we'll be back.
ಹೃದಯಗಳಿಗೆ ಹೊಸ ಜೀವ ತುಂಬುತ್ತಾ ಅನೇಕ ಜೀವಗಳನ್ನು ಉಳಿಸುತ್ತಾ ಸಮುದಾಯದ ನಿರಂತರ ಸೇವೆಯಲ್ಲಿ 25 ವರ್ಷಗಳ ಪಯಣ. ಈ ಮಹತ್ವದ ಮೈಲಿಗಲ್ಲನ್ನು ಆಚರಿಸುತ್ತಿರುವ ಸಂದರ್ಭದಲ್ಲಿ ಬೆಂಗಳೂರಿನ ವೆದೇಹಿ ಆಸ್ಪತ್ರೆ ವೈಟ್ ಫೀಲ್ಡ್ ನಿಮಗಾಗಿ ವಿಶೇಷ ಯೋಜನೆಯನ್ನು ಪರಿಚಯಿಸುತ್ತಿದೆ. ಗುಣಮಟ್ಟದ ಆರೋಗ್ಯ ಸೇವೆ ಕೆಲವರಿಗೆ ಮಾತ್ರವಲ್ಲ, ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಸಿಗಬೇಕು ಎಂಬ ನಮ್ಮ ಪ್ರಯತ್ನ. ಅತ್ಯುತ್ತಮ ಗುಣಮಟ್ಟದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳನ್ನು ಈಗ ಅತ್ಯಂತ ಕೈಗೆಟುಕುವ ವೆಚ್ಚದಲ್ಲಿ ಪಡೆಯಿರಿ. ಸರ್ಕಾರಿ ಆರೋಗ್ಯ ಯೋಜನೆಗಳ ದರಗಳಿಗೆ ಅನುಗುಣವಾದ ವೆಚ್ಚದಲ್ಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳು ಮತ್ತು ಈ ಸೌಲಭ್ಯಗಳು ಎಲ್ಲ ರೋಗಿಗಳಿಗೆ ಲಭ್ಯ. ಜನರಲ್ ಸರ್ಜರಿ, ಆರ್ಥೋಪೆಡಿಕ್ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ, ಕಿವಿ, ಮೂಗು, ಗಂಟಲು ವಿಭಾಗ, ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆ, ನರಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಮೂತ್ರರೋಗ ವಿಭಾಗ ಸೇರಿದಂತೆ ಹಲವು ವಿಶೇಷ ಚಿಕಿತ್ಸೆಗಳು ಒಂದೇ ಸ್ಥಳದಲ್ಲಿ. ಅನುಭವಿ ತಜ್ಞರು, ಆಧುನಿಕ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ಕೊಠಡಿಗಳು, ವೇಗವಾದ ಚೇತರಿಕೆ, ಹಾಗೂ ಸಂಪೂರ್ಣ ಆರೈಕೆ. ವಿಶ್ವಾಸಾರ್ಹ, ನಂಬಿಕೆಗೆ ಪಾತ್ರ, ಕೈಗೆಟುಕುವ ದರ, ಪ್ರತಿಯೊಬ್ಬ ರೋಗಿಗೂ ಶ್ರೇಷ್ಠ ಸೇವೆ ನೀಡುವ ಬದ್ಧತೆ. ವೆದೇಹಿಯಲ್ಲಿ ಆರೈಕೆ ಎಂಬುದು ವಿಶೇಷ ಹಕ್ಕಲ್ಲ, ಅದು ಪ್ರತಿಯೊಬ್ಬರ ಹಕ್ಕು. ವೆದೇಹಿ ಆಸ್ಪತ್ರೆ 25 ವರ್ಷಗಳ ಶ್ರೇಷ್ಠ ಸೇವೆಯ ಸಂಭ್ರಮ. ಆರೈಕೆಯ ನಿರಂತರ ಭರವಸೆ.
और ग्राइंडिंग मशीन से मेरा हाथ कटिंग हो गया था। कटिंग होने के बाद में दूसरा हॉस्पिटल में गया, उधर ऑपरेशन किया। ऑपरेशन सक्सेसफुल नहीं हुआ। मेरा नाम MD बादशाह खान हूँ। मैं वेस्ट बंगाल का रहने वाला हूँ। मैं गूगल में मैं सर्च किया ये हॉस्पिटल के बारे में। मैं सोचा इधर आने के बात किया, डॉक्टर लोग के साथ में मिला। मिलने के बाद में सर मेरे को बताया पहले एक सर्जरी हुआ तो हम लोग देखना है इसका अंदर में क्या प्रॉब्लम है, नहीं है, ना ज्वाइंट हुआ क्या नहीं हुआ। हम लोग ऑपरेशन करेंगे। ऑपरेशन के बाद में आपका हाथ सही हो जाएगा। 90% घूमते 80% बराबर आपका हाथ सही हो जाता।
This gentleman came to us about 9 months back with complaints of inability to move the hand along with loss of sensation of the hand. Patient had sustained injury about 2 years back, following which he was operated twice elsewhere. In spite of that, patient did not find much improvement. We operated him 9 months back. We have done tendon reconstruction along with nerve reconstruction and some tendon transfers. Now after 9 months of good physiotherapy, patient is able to move the hand. He has also got sensation back and is able to do most of the work which he was doing previously. This our procedure has improved his quality of life significantly.
सर मेरे को बोला था 2 साल लगेगा टाइम, क्योंकि 2 साल भी नहीं लगा। 9th मंथ हुआ। 9th मंथ के बाद में मेरा उंगली सभी मतलब वापस आ रहा है, पहले से ज्यादा बेहतर मालूम हो रहा है, ताकत मिल रहा है थोड़ा सा उंगली में। डॉक्टर सर बोलने के बाद में मैं फिर आज आया सर के साथ मिलने के लिए। सर भी देखा हाँ तुम्हारा हाथ अच्छा है। मेरे को भी थोड़ा सा सुन के अच्छा लगा। मेरा हाथ बहुत अच्छा है पहले से ज्यादा।
Welcome back, everybody. We are continuing our discussion with our Dr. Durgaprasad Reddy sir. So we were talking about the technologies increasing. So in the medical procedures, we have heard a term called TAVI. So what is it, sir?
Yeah, this is a transcatheter aortic valve implantation. That means if the aortic valve, there are 4 valves in the heart. One of the valve is called as an aortic valve, which guards the aorta. It supplies blood to the complete this one. So suppose the aortic valve is diseased. What we do is we do open heart surgery or a minimally invasive surgery and replace the valve. In TAVR or TAVI, what we do is we don't cut the chest open. We enter into the femoral artery with a catheter, and the valve is mounted on that catheter, and we go there and implant that valve. But the only disadvantage here is we don't remove the diseased valve. We just open up the valve and push the valve inside. This is very good who are unfit for surgery, who are very frail, who are not at all operable. Their other general conditions are not suitable for surgery. And these valves work for 10 to 12 years. So it's always preferred to take a patient who is above 70 years of age. Youngsters, TAVI or TAVR is not advisable, because we can do minimal invasive or open heart aortic valve replacements. So I think TAVR is a good procedure if it's above 70 years. Yes. And there's some complications will be there, but I think it's fairly now we have also done quite a few number of TAVI, and it's a good procedure.
Yes, sir. So a lot of people fear of open heart surgery. So what are the other procedures instead of open heart surgery and for the people.
Yeah, that's good. Open heart surgery, people will get feared because they think the chest is cut open and the recovery is going to be that's a myth according to me. It's a worrisome because people have to put every patient has to be educated in this. See, they'll have to be worried what they have inside. They're carrying a time bomb. Instead of that, cutting them for 1 week of rest is not going to change major issues. So what I feel is open heart surgery is not to be scared. What the disease they have inside the heart is more dangerous. It's like a time bomb. It can stop. The heart can stop anytime. So people should get worried for the disease what they have. They should not get worried for open heart surgery. Open heart surgery can be through minimal invasive or complete chest open, whichever method they choose. We need to select on that. That as a surgeon, as a specialist, we select what is good for the patient. Whether can be subjected to minimal, whether he can be open the chest and do it. That all depends. Each patient varies in that. Not everyone can be subjected to minimal. Not everyone can be subjected to open heart. There are certain criteria we take it, and accordingly we'll do it. But ultimately, people should not get scared for open heart surgery. The reason is they should get scared for what the disease they have. That is going to be a time bomb. That is going to create a lot of issues for them. Okay.
So that's fear pair have an important role. So if I am having a heart surgery with fear, will it get increased, and how can you?
It is all just before surgery only the fear. After surgery, they themselves will understand it's not much.
Yes, sir.
The pain is not much. Cut is never painful. The stretching of the tissues are going to be more painful. I think a lot of associated, lot of good medications are there for pain, and I think pain is very, very small in this. There's not much of a problem. Once they get operated, they themselves will understand, this is very simple.
Yes, sir. So speaking about services, and how was our hospital, our Vydehi Institute in cardiac services? So before we complete,
we'll take this question. Morning, ma'am. Morning, ma'am. Yeah, morning, ma'am. I'm listening to you.
Good morning, sir.
Yeah.
Sir, ನಮ್ಮ ಹೆಸರು ಬಂದು ಮಾಯಾ ಅಂತ.
Okay, ma'am.
ಸೊ ನಾವಿಲ್ಲಿ ಈ ಕಡೆ ಭಾರತಲ್ಲಿಂದ ಕಾಲ್ ಮಾಡ್ತಾ ಇರೋದು. ಸರ್, ಇದೇನಂತ ಅಂದ್ರೆ ಒಂದು ಈ ತರ ಜಾಸ್ತಿ ಏನಾದ್ರು ಟೆನ್ಷನ್ ಅಥವಾ ಸ್ಟ್ರೆಸ್ಫುಲ್ ಏನಾದ್ರು ತಗೊಂಡ್ರೆ ಹಾರ್ಟ್ಗೆ ಏನಾದ್ರು ಪ್ರಾಬ್ಲಮ್ ಏನಾದ್ರು ಆಗುತ್ತೆ ಸರ್?
ಇರ್ತದಮ್ಮ, ಸ್ಟ್ರೆಸ್ ಇರಬೇಡ. ಸ್ಟ್ರೆಸ್ ಇರುತ್ತೆ, ಹಾರ್ಟ್ ಇಟ್ ವಿಲ್ ಅಫೆಕ್ಟ್ ದ ಹಾರ್ಟ್ ಡೆಫಿನೆಟ್ಲಿ. Because your heart rate is going to increase, you are not going to be active, then it can block your arteries. Stress-free life is very important to live longer.
So, ಏನಂತ ಅಂದ್ರೆ ನಾವು ಜಾಸ್ತಿ ಏನಾದರೂ ಓವರ್ ಟೆನ್ಷನ್ ಅಥವಾ ಓವರ್ ಸ್ಟ್ರೆಸ್ ಈ ತರ ಇದಾದ್ರೆ
Why are you taking stress, ma? Don't take stress. Don't take over tension. Take it lightly. Things has to move on, right? So stress is you only have to control the stress. You divert your mind. What is creating stress for you? Don't get into that. Do something else. What is which is going to keep you happy? Okay.
ಓಕೆ, ಶೋರ್ ಸರ್. ಏನಂತ ಅಂದ್ರೆ ಜಾಸ್ತಿ ಏನಾದರೂ ಸ್ಟ್ರೆಸ್ ತಗೊಳ್ಳೋದ್ರೆ ಏನಾದರೂ ಕಂಟ್ರೋಲ್ ಆ ತರ ಏನಾದರೂ ಮಾಡೋಕ್ಕೆ ಸಾಧ್ಯ ಇರುತ್ತಾ?
Controlling stress.
Controlling stress is keeping yourself happy is one thing, ma. And don't get in. Why are you getting stressful, ma?
Like ಏನಾದರೂ ಫ್ಯಾಮಿಲಿ ಪ್ರಾಬ್ಲಮ್ ಆ ತರ ಆದ್ರೆ ಒಂದೊಂದ್ಸಲ ಜಾಸ್ತಿ ಟೆನ್ಷನ್ ಈ ತರ ಆಗುತ್ತಲ್ವಾ?
That you have to sort out, ma. See, you want to live longer, you want to keep your heart healthy, you have to sort it out with your family, not to create stress for you, and don't create stress for others. You have to talk to your family so that you are more stable at home. Stress is not good, ma'am. Not good. Okay.
ಸರಿ ಸರಿ. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Thank you.
Thank you, ma'am. So people are dealing with a lot of stress. So
Stress is a major killer now. That's what I said. The working member of the family gets hit in India because their work pressure, they have to come, they have to take care of family. So many things are there. So I think every people should be stress free. They'll have to find their own way to be stress free.
we'll take the call.
Hello.
Morning, sir.
Hello.
Yeah, morning, sir. Dr. Durgaprasad here.
Yeah, sir. Good morning, sir.
Morning.
My name is Rahul.
Yeah, please, sir. Please.
I am 35-year-old, sir.
Yeah.
Sir, first and foremost, I know you, sir. Some of my friends and their parents have visited you, and I have heard highly about you, sir.
Yeah,
So it
thank
is
you
an
for that.
opportunity for me to talk to you today.
Yeah, thank you. Thank you for that.
Sir,
You've been to
so I
Vydehi
just
Hospital, visited me here?
Sir?
Have you people have been visiting Vydehi Hospital at Bangalore?
Yeah, sir.
Oh,
Yes,
very
sir. I
good.
have visited, sir, but not for the cardiology department. For
Okay.
some other department I have been, sir.
No,
also.
that's great. That's fine. It's really good.
Yes, sir. Yes, sir.
Yeah.
Yes, sir. Sir, my query for today is, sir, because of the young people suffering from heart attacks and MIs, so I just wanted to know, is there any, for example, I have this kind of mild chest pain when I am stressed or when I am in anxiety. But it goes on, I mean, it goes out when I don't have any kind of stress and I'm completely on a
That's
holiday.
all. You gave the answer.
So I have got,
You
I got
yourself
my-
gave the answer, sir.
Yes, sir. Sir, I got my lab test done. I have got my ECGs done. I got my 2D echoes. They told to do something called TMT, which is absolutely normal, sir.
That's fine,
So
sir.
my
If
doubt for
your
today
TMT is
any-
normal, echo is normal, ECG is normal, you're out of cardiac problems, sir.
Yes, sir,
90%
thank you, sir.
you're
So,
out of cardiac
I
problems.
just want to know, sir, is there something called CT angio which has come? Is everyone can do that just to understand that they are having some kind of problem, sir? So I need your inputs on this, sir. CT angio, is it
Sir,
being performed
CT
regularly
angio
or,
can be done to see whether any blocks there in the artery, coronary artery is getting blocked or anything, because it's not an invasive procedure. They give a dye into your IV and get your, they'll profile your coronary arteries. Suppose there is any block, again the gold standard is you have to go for an angiogram. If the CT angio is normal, you don't have to worry about anything, sir. If you find any blocks in the CT angio, then you need to get your angiogram to see what we have to do.
So
Sir.
as a just secondary thing, we can get it done, sir. For any common person to get a CT angio is advisable.
If you're
or
symptomatic,
we
you're
have
having chest pain and you don't want to go for an invasive procedure, or you're having at high risk like diabetes, smoker, hypertensive, then you can go ahead with a CT angio, sir. Otherwise,
Is it
it's not
available at
required,
Vydehi,
sir.
sir?
Sir?
Is it available at Vydehi Medical?
Yeah. We have good CT angio. It will profile coronary very good. We have very good specialist, cardiac specialist, only exclusive for CT angio. Cardiac radiologists are available with us. Very nicely they profile coronaries.
Okay, sir. Thank you so much, sir. It
Thank
was
you,
very
sir.
helpful and it is honor to talk to you, sir.
Yes. Thank you, sir. Same here.
Thank you, sir. So, as they were asking about procedures and how is our Vydehi Hospital in cardiac services and how are we, organizing things for our
We've
patients?
been in cardiac surgery and cardiology workup for almost 22 years at Vydehi. So it's one of the best I can say, but it is not projected like what people want projection. It's not the question of projection because we keep doing our works. We don't have time for projections. But Vydehi has been very high in cardiac surgical and cardiac procedures, and we have done a lot of services also. Management, our chairperson, Madam Dr. Kalpaja, she's been very kind to give a lot of service to these patients who are undergoing cardiac surgery. They give a lot of free valves. Patients are operated in scheme charges. So these are very good things what Dr. Has been doing for us. And other thing is we have not sent back a patient who has come to Vydehi who is not having money. We make sure they get the treatment done. That is the specialty of Vydehi. We never looked at, the patient requires money for this procedure. We somehow arrange, we get this done. Hats off to management. They've been very kind to give us that opportunity to deal with these patients who don't have money, and they've been very kind, and they have their system to get this done. So that way we have done. That is how we've been able to do. See, imagine we've been operating bypass surgery for 60,000 when I started. I don't think anywhere in India we have done this. And even today we are one of the best pricing we do. And it's not the question of pricing. And the management is able to take that burden. That is what is the greatness of the management. I think most of the hospitals don't do that. That makes a doctor like us to stay, and we love this hospital because of that. And
Yes.
that is what it is.
Yes, sir. So our institute is now passing a milestone, like 25 years of silver jubilee over
Yeah.
here. On this occasion, we are organizing some camps and all. We regularly do so
Yeah.
in all our services. So how are we organizing the camps for the
See,
patients, sir?
the main goal for conducting camps and our management is interested is screen these patients. See, preventive cardiology has become a very big thing for us now because we don't want to go to streets, pick up patients. We want to operate. We want to do certain things. Nothing like that. We want to make sure this all these people are healthy. To screen them in such a way that we find their diseases at the early stage, and then we can treat them appropriately. Early catching them is much, it's good for me, good for the patient. That's all I put it. They come late, patient may not take it up very well, and that's not good for me because I am having a drawback. But the patient relatives, for them it's 100% setback. For me, maybe one in thousand. But for the relatives, always make sure the patient's party are more satisfied. You becoming a doctor, 1,000 cases you would have done, 10,000 cases you would have done, but one case going to be negative is going to be negative. So you make sure that negative doesn't happen. That's an advice I can give for most of the young doctors who are coming up. You know, so Vydehi has been very good in that. They make sure it is screening camps are done across India, and we make sure these patients are, if they have any disease, and all schemes are also eligible at Vydehi. So we also utilize schemes. Even if schemes are not there, we make sure we do something for them to get their treatment done. That's how it is.
Yes, sir. So we have spoken about all sort of symptoms, how to take care, and how our hospital is well equipped over years, how we have developed and everything. And we have also heard that our hospital has given a lot of patients successful surgeries
Yeah.
and all. So we really thank you for being
Thank you.
here and
Thank you.
sharing your valuable insights. And I feel all our viewers have gained knowledge how
Thank
to
you.
take care of our healthy heart. And so before we can we take the caller, sir?
Yeah, maybe the last call,
Last
I think.
call, yes.
Okay, go ahead. Morning, sir. Dr. Durgaprasad here. Morning, sir.
Mr. Pal, sir.
You,
Uh, sorry, sir. I think there's a
missed call.
missed call.
I think.
So yeah, thank you for taking
Thank
your
you.
time.
Thank you.
and
Thank you
sharing
for
your
this.
valuable
I think
knowledge.
hope the viewers are enjoying these things. And
Yeah, with
hope,
this call, I think your viewers will be taking care of their healthy heart. So to watch this, you can go to Vydehi live channel, like, share, subscribe. Until then, stay fit, stay healthy, take care of your healthy heart. Thank you, all of you, who has
that's
joined our
important.
session
Yeah.
today.
And no smoking.
Yes, thank
I'll have
you.
to finish with that because I've seen a lot of youngsters smoking. That's a killer, actually. What they show in movies before, non-smokers, that all the diseases, it's all true. I've seen youngsters laughing at those ads and other things. Please, viewers, take it seriously. Don't get into this. Thank you. Thank you, everyone, for this.
Thank you, everybody.